Hi, I'm Ashlyn Volpe,
And I am Pierre Lee.
and this is a public service announcement about diabetes and the importance of diabetic screenings.
Diabetes is a disease state that affects more than 25.8 million people in the United States. Unfortunately, diabetes leads to numerous complications and therefore it is the seventh cause of death in the United States. There has been numerous studies that indicate there exists a health disparity, with African Americans and Hispanics being diagnosed with diabetes more often than non-Hispanic whites.
The complications of diabetes include diabetic neuropathy, which is damage to nerves that occurs due to the result of prolonged elevated levels of blood glucose, which is seen in uncontrolled diabetes. Peripheral neuropathy most commonly causes pain, burning, tingling, and numbness of the feet and lower legs. This often leads to lower limb amputations due to unrecognized injuries and infections. Diabetic retinopathy, which often leads to blindness. Vascular disease, which often leads to heart disease and stroke, and kidney disease. Among the complications, there exist health disparities. For example, diabetic neuropathy can lead to lower limb injuries if daily foot examinations are not performed. When these injuries become infected, there is a high risk for lower limb amputations. Data suggests that African Americans are 2.7 times more likely to suffer from lower limb amputations. In addition, African Americans are also 2.6 to 5.6 times more likely to suffer from kidney disease and 50% more likely to suffer from diabetic retinopathy.
To prevent these complications from occurring, there are 4 recommended screenings that should be performed yearly. The screenings include 2 or more hemoglobin A1C tests, yearly foot examinations, a yearly dilated eye exam, and an annual flu shot. These are basic measures that can provide an assessment of the quality of diabetes management.
So, who receives the 4 recommended screenings that can help to prevent the complications of diabetes? The Agency for Healthcare Research and Quality performed a study in 2008 and 2009, and this illustrates the data collected. On the graph on the left, the data illustrated is the percentage of adults aged 40 and over who was diagnosed with diabetes who reported receiving the 4 recommended screenings based on race and ethnicity. As shown in 2008 and in 2009, only approximately 23% of African Americans and Hispanics reported receiving their yearly screenings, compared to approximately 25% of whites. Furthermore, the graph on the right illustrates the percentage of adults aged 40 and over who was diagnosed with diabetes who reported receiving the 4 recommended screenings based on income level. As shown in 2008 and in 2009, people of poor, low, and middle income were less likely to receive the recommended screenings.
The adjusted percentages of adults aged 40 with diagnosed diabetes who received the 4 recommended services for diabetes annually based on gender, race, family income, education, insurance status, and residence location was then analyzed. As shown, the biggest factor in receiving the annual screenings is income level. Poor income individuals are far less likely to receive the annual screenings compared to high income individuals. In addition, education also plays a factor, with a higher percentage of college graduates receiving screenings compared to high school graduates. Furthermore, the uninsured are far less likely to receive the annual screening, as there was only 10% who received their screenings.
Diabetics who maintain their hemoglobin A1C levels less than 7% can decrease the likelihood of complications such as heart and kidney disease, blindness, nerve damage, and stroke. African Americans and Hispanics are less likely to have their hemoglobin A1C levels less than 7%.
In order to manage diabetes, you can get informed at your pharmacy, such as the blood glucose and hemoglobin A1C screenings. Many pharmacies such as Walgreens and CVS offer free glucose tests and free hemoglobin A1C tests at their yearly diabetes awareness event.
Diabetics should perform daily foot examinations. These steps can help reduce the risk of lower limb amputations. Every day, the following care should be taken. Thoroughly wash and examine your feet for blisters, ulcers, cracks, or sores. Ensure your feet are thoroughly dried before wearing socks. Wear white socks. Wear properly fitting shoes at all times to protect from injury. Do not soak your feet in hot water and do not use a heating pad on your feet. Also, get yearly foot examinations by your physician.
Yearly eye examinations covered under health insurances. For the non-insured, yearly eye examinations are approximately $80 to $150.
People with diabetes should also have their flu vaccinations yearly. Preventative services are 100% covered under health insurances. However, for the non-insured, the flu vaccine is approximately $31 at retail pharmacies.
This PSA is brought to you in order to educate diabetics about the importance of having these annual screenings. The American Diabetes Association believes that diabetics are undereducated about the importance of these screenings and therefore calling on all health professionals to increase awareness. A great starting point on diabetic education is at your local pharmacy. There are many events and services pharmacies provide to diabetics.